One of the one of the things that's important when you are a dermatologist is to take the holistic approach to the body and not simply look only at the skin. So what we have is we have a patient who's been seeing a lot of physicians with the problem of itching all over the body, nothing is helping, multiple medications. And when you look at the patient, you have to have like a gist of what's really going on. And once you get the gist of what's going on, you need to go ahead and examine the stuff to prove whether indeed your ideas are the cause. So here we have a lovely lady. You can show without the face, you can show the body. It was kind enough to show us. You see she's got some bruising. She's not taking any medications though that will allow the explanation of the bruising, okay? She doesn't take any blood thinners, right? Then if you look further, you have to undress the person, not be afraid to touch them. You see the ankles. The ankles are a little bit swollen, not too much. And then everywhere there are scratch marks. So there are no primary lesions. They're all excoriations. Now, of course, you can think of a lot of differential diagnosis, scabies included and stuff like that. But nobody else is itching, that it's not exactly scabies. And then you look at other places and you notice that, look at her nails. Yes, she does have nail polish on there, but she does not have nail polish on her toes. And on her toes, you'll see this white area. It's about 80-20, maybe some nails you can say 50-50. So this is basically Terry's nails, or some people say Lindsay's nails, depending on how much of it is white and how much of it is pink. Normally, you look at my nail, you can see it, the lunula is only white, the rest should be red. So that means there is an issue with the albin, with the protein. So where is that being processed? So all this that we learn in med school that we think is boring is actually coming alive in a situation like this. And then we think about the liver. So is there an issue with the liver? She says, no, not really, maybe a little bit. Well, if you look here, this surgery was because of urinary bladder. But if you do, there's what's called a fluid wave. So why don't you show us the fluid wave? So the way you check for fluid wave is you put, this is called a situs. You put your hand in the middle, you hold here, and it's kind of like you feel the force, you kind of put, and you can actually feel in the other hand the fluid wave shaking, moving around. And then as you press down, it hurts a little bit on there. Yeah, you can see her face changes, and I gently pressed. So you understand that there's an issue with the liver. So instead of wasting her time with steroids, which is what people have been giving, that can also increase the skin thinning and cause atrophy and bruising, you need to understand that this is something coming from the inside. We did a biopsy. The biopsy showed it was indeed prurigo nodularis, meaning scratching that's causing it. And when you look at her back, you understand that it's from that, because her back, where she cannot reach with her hands. Можно мы покажем вашу спинку?
Пожалуйста.
Спасибо. When you look at her back,
Только не сглазь.
дай Бог, никто не сглазит, вам
Да
все
я шучу
благодарны.
с вами, доктор. Я еще пошучу.
Ну, молодцы. When you look at her back, you can see that the back is really spared and where she's not able to reach. So you understand this is not really something that is, and she's mostly not getting out. So she's usually you get a butterfly sparing, and in her case it's sparing even more than that. So you understand this is not something that is related to a disease of the skin, but rather related to the itching that is coming out visible to us with the excoriation, which is called prurigo nodularis. So anyway, this is why it's important to get the holistic approach, whatever profession you're in, to the patient, so that you can better help them and hopefully cure them. Thank you for watching, and hopefully it was educational. If yes, please let me know. Have a good day.
Prof.
Thank you.